We're a busy practice, but I think it's a good learning opportunity for fellows. We see a wide variety of cases. We're the largest group in the region, so it allows our faculty to be diverse in the areas they choose to focus on.
For sure, you're going to need to know the bread and butter cases. We have numerous numbers of cases available. With the faculty that we have here, we're all very busy. We can easily provide that to fellows as well as the medical students and residents that come through. So our volumes are high. We do a lot of intricate cases, including spinal cord stimulators, kyphoplasties, and so we do a lot more of the advanced cases, and you will be very comfortable with those as well.
I knew that the fellows get a very diverse education, lots of hands-on exposure to all aspects of pain medicine, and that was a very attractive thing to me.
We offer our fellows excellence in training. We treat them very well. We treat them like junior faculty because the way we see it, if they weren't doing their fellowship, they would be our colleague. So we consider them to be our colleagues. We want someone who is going to work well with others, someone who is ready to learn.
We really look for someone who's a self-starter. And what I mean by that is it's a busy practice, but we give the fellows a lot of opportunity to dictate their schedule, to dictate the focus of what they want to get out of the fellowship. And so we're looking for someone who can come in and say, hey, I know when I leave, this is how I see things, this is where I want to go.
Sometimes our pain patients are stressed and anxious, and it takes an extra special touch to be able to reach out to those people and say, hey, I'm listening, I'm here, and I think we need fellows that can show that concern.
We have more faculty than we have fellows, and that's on purpose, and we do that because this should be a learning opportunity, not a service opportunity. And so, we certainly want people to come in and have every opportunity to participate in interventional procedures and clinic and things like that, but it also has to be balanced, that we want a workload that accommodates studying and accommodates research and accommodates family life.
When you're here with us, we're taking the time to teach. We're giving you as much autonomy as you can handle at the level of training you are, and we're always here for questions.
Everyone has their own clinical niche that they that's unique, and at the same time very complementary with one another, very collaborative, very nurturing of trainees both at the student, resident, and especially fellow level.
We are very receptive to learning new things from fellows. In fact, I very commonly ask my fellows, what would you do? What are your thoughts? What do you think we should do? And most of the time they have a fabulous perspective that I may not have thought of, and I really welcome that because we definitely consider them as our colleagues.
Ultimately, we think when people leave, they represent us as a university and as a teaching program. And so we want students to come out well educated, well trained, ready to go in the workforce.
I think the best thing that we can hear from our fellows is they were ready to do the job. There's always going to be some nervousness when you start a new task and you realize no one else's name's on the bottom line of that report. But for fellows to say, I got the training I needed, and I felt comfortable starting my practice. That's the best thing that we can hear.